Atul Kulshrestha, consultant physician and diabetologist at Agra. This message is for all the patients who are having hypertension. As we know that blood pressure normal range is must for all the persons. If the blood pressure is above the range, then we label that person to be a patient of hypertension. Hypertension means when the blood pressure is persistently more than 140 by 90 millimeter of mercury at any age. If the blood pressure is persistently means more than 2 to 3 times if you take blood pressure, if it is consistently high, then the patient is termed as high blood pressure or hypertension. The hypertension, although it looks to be a benign, but the most important thing is the hypertension is the most important risk factors for various diseases like heart disease, brain stroke like brain thrombosis, brain hemorrhage. Similarly, lots of problems are associated with nerves, etc. They are all related with hypertension. So in order to keep these problems away, it is important to control your blood pressure in the normal range. For some basic things is important for the person for having hypertension. These basic things are the change in the lifestyle of a person. Lifestyle change means that there are 3 things. First is diet, second is exercise, and third is mental relaxation. For diet, hypertension, if a patient is having hypertension, the low salt intake is advised to the patient. The salt intake for a good diet must be below 6 grams of salt, normal salt per day. It can be in any form, visible as well as invisible form. Similarly, as far as the exercise is concerned, mild walking and mild exercises, they are very good. Yoga techniques are very good. Lots of yoga techniques are available. By that, you can have a good relaxation of the body and the blood pressure will be controlled very well. Similarly, if you are having mental stress, then mental stress must be controlled. For that, the best thing is again walking. Second is meditation, pranayam, and these things are very important for hypertensive patient for control of the blood pressure. If with these things, blood pressure is not controlled, if it is fixed, then the treatment must be taken and the help of drugs must be given to that particular patient. Different types of drugs are available for the treatment of hypertension, but it must be very clear that initially when you start the treatment, just ask the doctors to take blood pressure repeatedly, many times. You visit the doctors many times and try to adjust the dose of the drug according to your blood pressure levels. Once your blood pressure is controlled with the drugs, do not forget to take the blood pressure pills daily or regularly. If you are taking the blood pressure pills irregularly, that is very, very dangerous and that can lead to the brain stroke and high blood pressure and brain stroke and heart attacks. So it is very important that when you are taking the blood pressure tablets, then you continue to take at the same time daily without any break. If you are having any further problem, suppose you are having high loose motions, you are having fever and so on, in spite of that, do not miss the blood pressure tablets. And when your blood pressure is very well controlled, then the complications, the long-term complications of the blood pressure can be checked very well. As far as the different diseases are concerned, if blood pressure is present with heart patients or if blood pressure is high in diabetic patients, then these are very dangerous combinations. And in these combinations, it is very important to control the blood pressure as normal as possible. With this, I am ending my talk and I will advise further that if you are having high blood pressure, try to control the blood pressure with the support of the drugs. modify your lifestyle, decrease the stress from the life, increase the physical activity, decrease the salt intake, and decrease the fat intake if you are overweight. Thank you.